Welcome to the Enterprise Mobility Roundup podcast, brought to you by BlueFletch. We discuss technology topics related to Android and workforce devices and how they intersect with business and mobility.
Hello, and welcome to another episode of the BlueFletch Enterprise Mobility Roundup podcast. I'm joined by Lee DeHihns, head of sales BlueFletch, and today we're going to be discussing recap of conferences and events we've attended for Q1. So, Lee, thank you for hopping on with me. I know it's been about 3 or 4 months since we've done one of these, and it's not for lack of wanting to do it. It's more that you and I have both been on the road. A lot of the folks from our team have been on the road for the last 3 months at various conferences, which is the nexus for this. I think we wanted to cover some of the key themes we saw at various events we went to, and just some of the key takeaways we had from those. So, Lee, thanks for hopping on with me today.
Sure thing.
To hop into it, there's two very, very big conferences we went to. The first one was NRF. This is NRF Big Show. Is that the actual formal title of it?
I believe it's the NRF Big Show. Yeah, so it's the National Retail Federation. It's their largest show that they do every year. Despite the name national, they do global shows, and this one's obviously retail focused. Always in New York City, always at the Javits Center on the west side of Manhattan. About 40,000 people, 1,000 exhibitors, always second week of January, so you can count on some really nasty weather every year. But it's something I think we've been doing as an organization since 2014 or 2015.
Yeah, I feel like everybody always gets the cold or flu from that. How did you fare this year? Did you end up okay?
I did okay, but I think I probably went through 3 bottles of hand sanitizer.
I definitely saw you walking around with those. It was
Yeah, and I steal them off of everybody's tables if I see them. But yeah, you got to be on your toes to try to not get sick there. But it was a really good show for us. I enjoyed it.
So if you're an exhibitor at NRF and all your hand sanitizer went missing, we found the guy.
It's me. You just follow the guy with the super dry hands now, but I'm healthy.
So to hop in, I know there was a couple of themes we saw. So, and I think as we looked at this, you and I talk about this outline. I think that we've been to NRF in the past. We've seen a lot of things. I think things that are repeat themes, we're not going to include those unless there's something new or novel about it. But
Sure.
talk through the themes. I think the first one, which was this is similar across all the conferences we went to, is really around the dominance or prevalence of AI. What was your take or your read? What's some of the key things you saw at NRF around artificial intelligence?
Sure. So I think AI is a tough thing to define when you just hear it. Everyone's like, oh, this is probably important and good. But I think what it comes down to it is like a practical focus for it. And what we really saw from a retail perspective was a focus on personalization. And that's not only for the associate, but primarily for like the customer experience. Also inventory management. Dynamic pricing is something that you're able to see now based on demand using AI. And we'll get into it a little bit more on how the prices are changed dynamically in one of the other points that we can talk about. And then just general operational efficiency. So those were kind of the key areas for it. So AI as an umbrella, not necessarily helpful to read that on every booth, but if they had things that were actually practically applicable, I think it can make a lot of difference.
Yeah, I makes me think of the article you and I talked about last quarter, which was nobody talks about their transistor strategy or their electricity strategy. It's just an underpinning, like fundamental tool that helps you
Right.
solve problems. So it makes me think that AI is starting to actually mature into that space, which is always interesting to me. On that note, the second theme you and I talked about was the focus on customer experience and personalization or customer personalization. What's your,
Yep.
any key things you took away or you observed at NRF around that?
Yeah, so the saw a real heavy focus on real retailers creating a very authentic and tailored experience in their stores that was, think of the execution of the brand down to everything in the store from the hardware, the shelving, the lighting. I talked to one retailer who actually sources deer antlers from a processing shop in Wisconsin for every one of their stores, just because it's that important for them to have like their outdoor brand experience in each and every one of their stores. and really focusing on when the customer is in there, utilizing the AI aspect of it to make that customer feel like they are known. So going from, kind of taking the online and marrying it to the in-store experience. So when someone walks in there, the experience they got online is going to be the same thing they saw in the store. There's the ability to, continue shopping from one to the other, that whole endless aisle thing that was really seeming to come together this year.
Yeah, I think it almost feels to me like a whiplash from everybody going digital during COVID to people wanting to be in stores and looking at some of these successful brands, like I'm going to call it the Chick-fil-A experience, where everybody saw how well they did, where they had that personalized, high touch experience. And I feel like I like the fact that that's making its way back into retail.
Yeah, I think it makes a big difference.
Which,
Um,
which like I think the point number three or theme three, which I wrote down, is where did the robots go?
yeah, absolutely. No one wants to hug a robot and no one feels personally loved and touched by a robot when they go into a store. So I think for the time being, robots are back of house and DCs, right? I know Amazon's building a whole robot-enabled DC right now, but I think that's where robots are probably going to be staying in the near future, as long as personalization is the focus.
Yeah, no, I agree with that. Nobody wants to hug a robot, especially a little mean robotic dog.
Yeah, exactly.
So the fourth thing that we noticed, and I know you and I did a couple walk arounds talking to different vendors and partners and companies, but the maturation of digital displays and how that's gotten better. What stood out there to you around the digital display space?
Sure. So, we've been in the digital space, BlueFletch as a company for a couple decades now, and some of our early projects involved, really complex integrations with TVs, with USB drives that we were trying to program stuck in the back of them, trying to, really consolidate and keep consistent the digital out of home experience. What we saw this year was a real advancement in the e-paper displays that are out there. So essentially, same thing as a Kindle, but at like full digital monitor size. They look great. They're really easy to maintain. They use virtually no power. They can be controlled centrally. So it was just really interesting to see that in pretty much every retail technology booth that we saw. And then dovetailing directly into that is our next point. The electronic shelf labels, or ESLs. So I think ESLs have been around for at least 15 years, and you've been hearing every year, like, this is the year this whole store is going to ESLs. But I think they finally reached a maturity, or maybe reached a point where the price point is at a level where they're easy enough to deploy. And so you're starting to see a lot more of those out there. There's some really interesting integrations you can do with ESLs, with small e-paper displays on there, so you can have product specific information. You can do dynamic pricing like we talked about earlier. It just makes a much more self-educated and seamless shopping experience if you're in a store and you see those things.
Yeah, I think on the ESL and also the e-ink side, I think one of the things I noticed there, now you mentioned it, was I feel like those help mitigate a lot of the power issues that you run into in digital displays. And I know one of the vendors, I think it might have been Samsung, had a display that was fully powered by itself and
Yeah.
would the full day. So you can actually move it around different locations in the store. So it's interesting that people with the lower power consumption, you actually start to get more portable experiences like that. So on the theme of experience, so theme six you guys saw was, I'm going to call it employee UX or EX or employee engagement. What were some of the things that you observed around that stood out to you around employee engagement?
So for a long time, retail has suffered from a lot of turnover rates. And I think what's interesting is, because of that high turnover, two things have started to coalesce in terms of employee experience: is making the employee's job as easy as possible, giving them really useful tools that don't require a lot of training and are very intuitive. So like making the mobile device that's in their hands look and feel as close as possible to what they're using in their day-to-day lives, to eliminate a lot of that training. But then on the flip side of that, they're trying to mitigate turnover, but then also they're trying to increase employee experience from the perspective of making people's jobs more enjoyable, so they want to stick around longer. And they're seeing, I think it's an actual investment in the employee and the employee experience, because people are understanding that you can get customers to come back in the door at those stores if the people who are working there are happy and are wanting to help them out. So leveraging that top technology in hand and really making information easier for them to get to, I think is the focus around that.
Yep. You sort of touched on this with the electronic shelf labels, the year of the ESL, but I know one of the things we've joked about in the past is that the year of RFID.
Mhm.
I feel like, and one of the themes, I think I described the theme as RFID is becoming more affordable. Like what did you see there? What were some of the key thoughts you had on the RFID space?
Yeah, so RFID is definitely becoming more affordable, like per label. But I also think people are figuring out how to use it in a retail experience, not only for the shopper, but for, like we talked about, the employee. So for example, when we were in the direct source booth, we had, I think, 4 different kinds of hats that all had RFID labels assigned to them. And we could scan an entire shelf array. If someone wanted, say, a brown hat in size large, we could see exactly how many we had in stock and where it was and what the price was. And being able to do that without having to, if you've been to some of those large retailers where you have to go like aisle 37, bay 15, row 6 to see if something's there and then it's not. This is super helpful, that I think you can have RFID to be able to scan a really large area to see if something is there. And so it allows you to do, and since you can do point of sale right there as well with tap on glass payment, something else we displayed at NRF, you can deprecate that from inventory right there on the fly as well. So you get really good analysis on sales trends, but also on just inventory management and things like that. And seeing a real application for RFID outside of just something like loss prevention, with having someone walk through an RFID on an array on the way out the door, I think is going to go a long way to making it stick if people can see it moving the needle from a sales point of view.
Yeah, make it easy, as they
Yeah,
say. Um,
absolutely.
the next theme, and this is verges on a theme that we've seen consistently, but I think mobile becoming a primary channel.
Yep.
And I think a lot of this, it was driven by COVID, but people went from a screen back to wanting, as you mentioned, like the endless aisle experience with their mobile devices, what they transitioned into store. Um, Anything else that stood out to you around that sort of mobile plus physical store experience?
Yeah, we're seeing a real drive towards retailers wanting to have a device in the hand of every employee while they're on the floor during their shift. So you can, when you're engaging with a customer, there's studies that you see a lift in spend of about 15% if someone engages with an associate when they're in the retail environment. So if you have an associate in the retail environment that you're engaging with, they can help you find your purchase right there on the spot and pay for it and check out. The likelihood of you wanting to continue to work with that person is high, and your spend's going to go up. But then also having these devices for the associate perform a multitude of tasks for them. So if they need to do a cycle count, if they're doing buy online, pick up in store fulfillment, even if they need to dock it and have it be essentially their laptop replacement, like we're seeing a lot for managers with tablets. I think people are realizing just the modularity of what you can do with a mobile device. I don't think we've seen the end of the executions of how that can be deployed in the store environment.
Yeah, it's a good call. Well, I'll hop back into that. A couple questions about our demo here in a second. But the last theme, which is theme 9, we had was, uh, and I know you and I spent quite a bit of time just talking to the folks at the ELO booth. So Target and ELO put together a demo, and I had posted on LinkedIn about it. But I think the thing that impressed me the most was thinking about accessibility and making it affordable for companies.
Mhm.
Do you want to like re-describe what we saw and what we took away from those discussions?
Sure. So, like Brett said, Target and ELO had a booth at NRF. I believe it was the ELO booth and Target's display within it. The Target has reimagined their point of sale so that it's accessible to people that are vision impaired, hearing impaired, or mobility impaired. from the perspective of maybe being in a wheelchair. So everything is height adjusted, including even like a touchscreen, for example. So everything's below a certain line on the screen for anything you need to interact with. There's the ability to plug in headphones if you're hearing impaired. There's the ability to do different button touches with Braille for if you're visually impaired. Just really interesting that recognizing that it's not always easy for everyone in day-to-day life. And, even from a target experience perspective, it makes it easier for their employees too, if they know that each shopper in the store is empowered to, sort of take care of themselves, I guess, for lack of a better way of putting it. But what was cool about it is Target and Elo developed all this standard for what a point of sale terminal should and could look like if you're accounting for accessibility, and they open sourced it. So anyone can take what they did and implement it across their stores. It was really cool.
Yeah, I love it. I called it my favorite innovation of NRF, even though, didn't include AI or all these other things, just like really thinking about interacting with the customers and help people out.
Yeah.
On that note, I know we talked about the mobility for users and a lot of things moving away from workstations towards mobile devices. So do you want to talk about what we showed off at NRF? Maybe the quick highlight of what BlueFletch did there?
Sure. So I touched on it a little bit earlier, but BlueFletch was in the direct source booth. And what we had was a retail application that was on Zebra devices and Honeywell devices that were enabled with RFID. So a user could come into the booth, or an associate could come in as the associate with the device. Customer could come in, determine what hats were available in stock using RFID, like I talked about earlier. And then they could fulfill that order right there on the floor by saying, hey, here's your hat in your size and your color. You can take it with you right now. We can transact the payment right here on the device with tap on glass with PXP payment. And I think you're seeing a lot of that. Some stores did it early on, but now I think it's going to start getting much more widespread, so that you can just basically check out where you are in the store as opposed to having to walk to the front, and just increase that employee interaction. So what we did there was showcasing that particular retail interaction, but then also kind of driving that is the NFC login experience on newer hardware. So if I'm an associate, I come in at the beginning of my shift. All I have to do to log into my applications to do my job is tap my badge and enter a 4-digit PIN. So we showed that aspect of it. And then once I'm in, I'm operational and ready to help customers and, complete transactions.
Got it. So aligned to a lot of the themes we talked about above. So
Yep.
shifting gears to the next, I'm going to call it like mega conference.
Mhm.
But HIMMS was something that's I guess, can you talk about what HIMMS is and who goes there, what's shown there?
Sure. So HIMMS is it's a healthcare conference, and HIMMS is it's a beefy acronym. It stands for Healthcare Information and Management Systems Society. It's another one of those giant international conferences. I think there's around 30,000 people there. It was in Las Vegas. It was the first week of March, so March 3rd through 6th. Richard Makerson and myself attended. Most of the people who attend are technologists within hospital and healthcare systems. So if you think about it, like let's take the clinical aspect from a nursing point of view. So chief nursing officers, chief nursing informatics officers, the IT departments and operations departments within hospitals. So basically making sure that the hospitals have the baseline technology and infrastructure to ensure the best patient care possible. Those are the people that attend this event.
Got it. And the themes, I know you'd jotted down a couple themes just based on the notes of what you guys saw. But the first one, also artificial intelligence. So
Yep.
what did you see at HIMSS related to healthcare and technology around AI?
Yeah, it's interesting because Richard and I were talking about it, and it was before the conference had started, and both of us were trying to guess how AI was going to be presented at the conference. Because again, it's like AI umbrella, and then you're like, all right, well, how can that actually help me out? So what we saw, and both Richard and I were concerned with, feeding data into an artificial intelligence model particularly if it contains patient data, how are we going to handle security? So that was something that was interesting to us. Microsoft had a booth there that they essentially are presenting AI infrastructure platform that allows you to manage your data and do data cleanup and data security across different systems. So that was pretty interesting because the amount of information that these organizations are taking in, but not necessarily synthesizing. I saw something the other day, was kind of death by dashboard, but they're not necessarily analyzing any of it or making sure that it's being safely stored and used. Microsoft has a whole infrastructure platform that they're going with, which seemed pretty interesting. So really what they're trying to do is take existing data and help out cleaning it up and getting information out of it. So when you're looking around like planning, services for patients, patient outcomes, that kind of thing, just understanding all this data you're collecting, how to get those key metrics out of it. Also, another thing that was talked about quite a bit was making sure you're coding and charting correctly for clinical interactions with patients. So take, for example, a knee replacement in the OR. Probably if you had 10 different nurses in there, you'd chart it 10 different ways. And that means you're going to be, as a hospital, reimbursed by insurance 10 different ways, some of which may be much less than what you should actually be getting. So leveraging AI to make sure that if you've got procedure A with equipment B and outcome C is what's supposed to happen, typically these are the charting actions that need to be occurring. And then you can just check off from there, as opposed to just having it being an open-ended question. So kind of around the whole like clinical decision support system is what we were looking at from an AI perspective. So it was pretty interesting.
Yeah, it's definitely seems like a area that's ripe for leveraging that technology if they can figure out the HIPAA and security requirements.
Absolutely.
Next theme was around, along the lines of HIPAA, cybersecurity, or
Yep.
cybersecurity in the healthcare space. What were some of the key things that resonated around that for you guys as you talk to folks?
So privacy obviously is the overarching theme. It's just a rule to live by within healthcare. A lot of things that we saw around zero trust infrastructure, biometrics, not only for the healthcare workers for login, but also for patients to validate that the care that's being administered on that patient is the correct person, because that happens a lot more than you might like to think. And then also just from, making sure that the pharmaceutical side of things, prescriptions are being dispensed to the correct person. They know who checked those prescriptions out before they administered the medications. And a lot of just making the experience on device for clinical workers, for frontline workers when they're logging into healthcare devices, making single sign-on as secure as possible, and particularly on log out if there's things around EHRs and communications with patient information, making sure that data is completely cleared off that device before the next person on the next shift picks up that device.
I know that's one of the things we've been getting a lot of inquiries around is, I know Improvata's been in that space for a while, especially as companies have started to move to Android. Uh,
Mm-hmm.
we've gotten a lot of inquiries, which is one of the main drivers for us being at HIMSS, was a lot of customers wanted to talk to us about that.
Yep.
I can see that. On that note, sort of the next theme was mobile technology and the prevalence of mobile technology moving into the healthcare space. What are some of the themes you saw there?
Yeah, I think mobile technology in healthcare traditionally has been a bit fragmented. A lot of times because doctors are going to bring the devices to work that they want to use and aren't necessarily going to be using hospital issued tablets, for example. But at the frontline level, particularly on the floor with clinical interactions, we're seeing a desire to have, because of security and because of patient outcome being the focus, a much more unified deployment with tablets and handhelds that are going to have each person who's interacting with a patient use a standard set of tools to standardize patient care as much as possible. So, we're getting rid of the clipboard for patients, even in terms of handing them tablets for intake at the beginning of hospital visits. We're even seeing tablets replacing bedside entertainment. So they're going to hand you a tablet when you're staying in the hospital. You can log into your own Netflix instance, things like that. Um, and Android start to show up in that space as well, because as tablets and handhelds are becoming more prevalent for frontline workers and for patients, you need a way to easily manage those things. And Android is definitely going to be the easiest of the three platforms, I would say, that are out there, between that, iOS, and to some extent Windows tablets as well.
We've seen a lot of vendors moving in that space too. I think SpectrumLink was probably the first one, and then Zebra with their HC series of devices, and now Honeywell and both Samsung have healthcare specific SKUs. So it's definitely the Android companies are pushing a lot into that space, and I think we're gonna see a lot less iOS there in the next couple of years.
I
Uh,
agree.
I think that the next theme you talked about, and it's sort of grouped into a couple things, but virtual care, telehealth, and then I guess remote or digital patient engagement. Maybe you could talk a little bit about what you guys saw around that as you talk to different vendors.
Sure. So I feel like telehealth really, it's a lot more mature now than it was prior to COVID. And COVID was obviously a huge driver of that, because people weren't necessarily able to go visit their doctor, or hospitals weren't necessarily taking in patients unless they had an emergent COVID related illness, but people still had other, you know, health needs that needed to be taken care of. So a lot of the initial visits during COVID got pushed to the telehealth and mobility side of things. So there's a lot of focus on that there, and looking at extending that telehealth to people that may not otherwise have the ability to go see a doctor easily because of either um, constraints on not being able to drive, or being far from a hospital. It's just really looking at telehealth as another part of the healthcare patient engagement ecosystem. Um, the other part we saw of that was actually technology, like in the field, like literally a mobile clinic, like an A-class tour bus size RV that was a mobile hospital that can be deployed for areas that may not have hospitals, like a rural area, or even in disaster areas where the normal health care facilities could be disabled or not reachable. And because of that, there's a lot of centralized monitoring systems that need to be stood up, so that these people can give frontline care in the field, but then have that information go back to a centralized place in order to focus on the overall patient outcome. So it was an interesting kind of full circle to see what was developed during COVID really get rolled out into what is now the norm for healthcare.
Yeah, can modernize. The next two themes, I think the last two themes, so that are sort of together, but I think the first one you articulated was just workforce challenges. Um,
Yep.
you can talk a little bit about that.
Yeah, a number of the booths we went into, particularly like Zebra, Honeywell, and Samsung, from a hardware perspective, they were just saying, like, look, healthcare is a very, very important field to work in. The people who work there tend to be undervalued and overworked. So we're here to make those jobs as easy as possible, because patient outcome is what really needs to be the focus. So there's a lot of focus on, there's clinical shortages. And so we're trying to make the job easier, or extend the shortages, or mitigate the shortages by making technology as easy as possible to use. So some of the things we saw were, companies trying to address holes in communication, where there's even wearables that are being paired to mobile devices now that you can communicate with without having to touch them. So you can stay sterile within the sterile field, but still communicate to someone at the end of the hallway at a charge desk or something like that. People are really thinking of a lot of the things that may be operationally rolled out in, say, a retail or warehouse environment. They're looking at those incremental gains there and looking at how they can shift to healthcare as well, with obviously the focus on making sure that privacy is maintained from a patient perspective.
Yeah, it's a communication tools in the field. So that's HIMSS, and the last one I know we're almost at the bottom of the call, so I'll go through these. But I think we went to a number of partner sales kickoffs. So we work with a lot of different resellers, OEMs, and attended a lot of their sales kickoffs, really as a partner to try to support them and help engage with their teams. And I think some of the themes there, I think theme one we saw was around, there's still a lot of customers that haven't modernized. So to your point around the healthcare, a lot of people on Windows, iOS, and pen and paper. So I think modernization there's still a lot of opportunities around that for the technology space. I think the second one was, I'm going to call this the Android Gen 1 refreshes. So I know companies like the Home Depots and the Lowe's and the Targets of the world started rolling out Android devices around 2013, 2014. Those are all pretty long in the tooth. A lot of those companies have already refreshed, but most of the followers are on a 4 or 5 year cycle for refresh. There's a lot of folks that are starting to refresh devices this year to take advantage of some of the newer tools, compute technology. Theme three, which is consistent with the other conferences went, a lot of the different OEMs and resellers were focused on AI. So really, and I'm going to call it looking for problems to solve with AI. So people are actually starting to look at problems, then applying AI to go solve those. It's been pretty clever. And then I think the thing we didn't see was, I know there's in the past a lot of concerns around supply chain, both on the OEM manufacturer side and on the reseller side. And I feel like that's really become quiet. I don't think I've heard anybody complain about supply chain in the last 2 years. Have you?
No, I have not. It definitely was a thing for a while where people were behind on device rollouts because they couldn't get them, but I haven't heard anyone mention that in a long time.
Yeah, and then I think the last thing of note was just a lot of interest around biometrics, which I know you mentioned that in the above around healthcare, but I feel like that's with the manufacturers and with the OEMs thinking about the balance of security, privacy, but also wanting to have the iPhone, Android phone experience for that you get on a consumer device. Those are some of the key themes. So
The trick is figuring it out from a shared device perspective. It's going to happen though.
yeah. So I guess Lee, in closing, if you had to say one or two things, what would be the things, the biggest themes you took away from all these Q1 conferences we went to and participated in?
Sure. So I think across everything we talked about today, it's really about operational efficiency and how that can be applied to really any industry. So in retail, operational efficiency is going to result in lower labor costs, higher sales, and better inventory accountability. From a healthcare perspective, it's going to result in, number one, most importantly, patient outcome and quality of care. And then number two, privacy. And number three, just trackability of what care is being given to each patient and making sure that hospitals are tracking that appropriately from a financial perspective as well in terms of how they're reimbursed by insurance or Medicare or Medicaid.
Excellent. Awesome. Well, Lee, thank you for sharing this with me today. As always, if anyone has follow-up questions, feel free to reach out to us at info@bluefletch.com. And if you like this podcast, feel free to share it or like it or do a little ding button on whatever side it is on YouTube. But thank you very much and have a good one. Appreciate it.
Thanks, y'all. Take care.
Thank you for listening to the Enterprise Mobility Roundup podcast. If you enjoyed the discussion, please take a few moments to rate us. If you would like to listen to future episodes, please subscribe. To learn more about mobility topics or submit any questions, visit us at bluefletch.com.